Namaste, myself Dr. S.P. Moosath. Many parents are asking about whether we can give medication in case of ASD or autism spectrum disorders. They are very frightened to give medications. So I would like to convey some message like why we should give medication, or in which condition or for what purpose we are giving medication. That we have to segregate first. It's not like medication is a broad term as per my point of view, because there are mainly in the mainstream there are four varieties that we can, or four categories that we can give medication. The very first category is that we know whenever we say hyperactivity, some medications are there to calm, to make them calm or sit quiet, or we can put a good name like the dullness of mind or dullness of activity. That also means those medications are also considered as a medication. The second variety is the medicines which is given for, or the supplements which is given for any deficiencies, like for in ASD cases there will be vitamin D deficiency or B12 deficiency. So supplementing those deficiencies or correcting the deficiencies with some supplements, that also comes under medication. But that we have to see for what purpose we are giving the medication. The third variety is to have a brain regeneration. Some medications are given like DHA, omega 6, or in Ayurveda we can say Saraswata, Brahmi. All those kind of medications are intended to have some change in the brain development. The fourth variety that I consider is the medication which is given for the gut correction. So based on gut brain theory, there is action in brain when we correct the gut. So for that gut correction also some medications are using. So we have to segregate for what purpose we are giving medication. Out of these four, I consider the gut corrective medications have to be given in the first. In the second level, the medications for the brain regeneration, that has to be given, but you should keep in mind that it should not harm the gut. Even the brain regenerative medication should not harm the gut. Even the preservative will harm the gut. So that is the second stage. Supplements, I don't consider supplement as a medication for long term. If the deficiencies are very much low, for time being, for 1 month or small period of time, we can give some supplements. Long term giving supplements is like similar to helping a kid during the exam or in the exam hall. The kid will pass the exam, but again for the next exam you have to help from outside. The same thing, the body itself is not correcting the deficiency. In the present scenario, I have not seen any kid deficiency causing through scarcity of food. Deficiencies are causing only with overnutrition, or the nutrition which is not properly absorbed by the body or used by the body. So Ayurveda doesn't consider the calories in the plate. Ayurveda consider, or the concept consider, the calories which absorb by the body, so that the digestion should happen, the absorption should happen, proper assimilation should be there. So if that is happening, there will not be any need of supplements. So supplements for time being we can give, but long term it is not advised. If it is advised, the capability of the body to correct itself will vanish, because we are getting help from outside. The first variety that makes the dullness of mind, it should not be administered for a long term. For certain conditions, if the kid is more hyper, we are not able to manage that much aggressive he is or she is, for time being we have to give. Again, while giving that also we have to find out the basic cause and treat accordingly. So the making the mind dull is not a proper way. Instead, we have to make the mind calm. That in Ayurveda we say the change of mind from Rajoguna to Sattuguna. In Sattuguna, the mind will be calm enough, the acceptance will be there, that acceptance will be there, or awareness will be there. While giving those medications, what happens is the dullness of mind. Many might have seen that. After giving the medication, the child will be calm, quiet, not able to do anything, that proper word is dullness. So keep in mind while giving the medications, we have to see whether it is given for which purpose we are giving. So not all medications are harmful. Some medications it will be helpful also. Namaste.